Today I'm going to talk to you about carpal tunnel syndrome, or rather some of the more common causes of carpal tunnel syndrome which you probably have not heard about before. Traditionally it's been thought of as the cause of the symptoms are from a median nerve entrapment that goes through the transverse carpal ligament or through the carpal tunnel at the base of the wrist located about right here. However, something that's overlooked by many healthcare providers is the fact that the median nerve can be entrapped anywhere along its course down the arm. And actually this is the course, this is how the nerve goes, right down here into the thumb, index finger, and middle finger. And any spot where the nerve is entrapped can produce the same type of symptoms as carpal tunnel syndrome. So a few of the more common spots we're going to talk about today is the right here. This is between the anterior medial scalenes where the brachial plexus comes out. Actually the brachial plexus comes straight through these two muscles, and this can cause symptoms of carpal tunnel syndrome, the numbness in the hands, also radial nerve entrapment, ulnar nerve entrapment, even thoracic outlet syndrome can all be caused through a brachial plexus entrapment at the anterior medial scalenes. The second part, or the second most common one, is down here at the pronator teres. When you consider the pronator teres, it also has two heads. So again, just like this, the median nerve is coming straight through, and when the median nerve gets pinched down by the two heads of the pronator, it also causes neurological symptoms. So when you consider what the pronator teres does, it pronates the hand. So with people working at a desk, they're like this a lot, and this can be a cause of median nerve entrapment for them. There's also at the transverse carpal ligament, we just talked about that, but also the thenar muscles. So look at all these different spots can have the same presentation as carpal tunnel syndrome, and that just shows how difficult this situation can be when treating it, but through surgical methods. Get a better understanding about the median nerve, how many spots it can be entrapped, how long it actually is, and how complicated the situation can be when you're trying to perform a surgery only at one spot. Carpal tunnel surgery is one of the most prevalent surgeries performed in the United States today, and a lot of times it's successful, sometimes it's not, but when you're going in for a surgery, you want to make sure that the carpal tunnel is the actual site of entrapment. So, if it is entrapped right here, normally the nerve will slide freely through the soft tissue. So if it's stuck right here, a lot of times it'll also be stuck right here. When it sticks there, it's just the relative slide is not as much here, and eventually you get the scar tissue and it'll build up here as well. Or you can get it here and here, or you can get it here and here. I mean, it's known as a double crush syndrome, and for that reason, I believe a lot of the surgeries are unsuccessful. So the treatment I use in my office to treat patients that come in with carpal tunnel syndrome or numbness into the hand, wrist, forearm area is called active release technique, or ART. ART has been known as an alternative surgery in many cases of carpal tunnel syndrome, sciatica, shoulder pain, knee pain, and even low back pain. They all respond very well to ART. And the reason why they respond so well, and let's stick to the case of a nerve entrapment, or let's stick to carpal tunnel syndrome. So nerves normally slide among the soft tissues freely without restriction. A lot of times they get stuck, and let's talk about the pronator. They get stuck, and it makes it so the nerve can't slide anymore. So what sticks it is called scar tissue. It's the body's normal way of repairing or repairing muscles. And the problem is when you get scar tissue laid down, it just kind of lays it down everywhere, and it makes everything stick together. A lot of times that's the knot people get in their upper back. But the fact is, they get stuck and pinched off. So ART will go in and will remove this scar tissue, helping the nerve slide freely through the soft tissues again, resolving the symptoms completely. ART is fairly unknown to the general population, but it's more popular in professional sports. In fact, many NFL, NHL, NBA teams all have active release providers that they see in whatever cities they visit, and even Olympic medalists have used active release technique. An ART provider in the case of median nerve entrapment will follow the nerve all the way up into the arm, up into the shoulder, find any restriction sites there may be where the nerve's entrapped to the soft tissues, and release them. This can be slightly uncomfortable at the time, but many patients will respond very favorably to the treatment within about 3 to 4 times, and will find a significant decrease in their symptoms. A lot of times the pain or the condition can be resolved within about 8 to 10 treatments. But regardless, a lot of times this is better than having surgery for these kind of conditions. For more information on active release technique, please visit www.activerelease.com. For more information on different kinds of conditions, please visit my other demonstrations or visit my website. So I'm going to show you a little bit how an active release provider will address the problem of carpal tunnel syndrome, or rather a median nerve entrapment. So the median nerve, it starts all the way up at the neck right here between the anterior medial scalenes, where it's part of the brachial plexus. That's a major nerve entrapment site for a majority of the nerves. It goes all the way down here into the forearm, where it goes between the two heads of the pronator teres muscle, down into the wrist at the carpal tunnel itself, right underneath the transverse carpal ligament, into the thumb muscles, and into the index finger and middle finger. Now an ART provider will follow the course of the nerve all the way up into the arm and into the neck, releasing any of the nerve entrapment sites that they may find. Many people will find a significant decrease in their pain or their symptoms within about 3 to 4 visits or so. However, some people have come back reporting that they find a significant change after one treatment. It's not uncommon to find that you have a different kind of soreness for about 48 hours or so after the treatment.